That Novavax has now announced that its COVID-19 vaccine is more than 90% effective, including against the new coronavirus variants of interest as well as the variants of concern. Now, this is an announcement that was made after a large-scale US study that involved 30,000 people in the US and in Mexico. Now, why is this important for India? Because Novavax has a tie-up with the Serum Institute of India. It is once again a vaccine that can be stored at that 2 to 8 degrees Celsius temperature, which makes it viable for India. And what we're also learning is that the company is likely to seek regulatory authorization for emergency use in India sometime around July to September. So how should we be looking at this news? We have Dr. Rajendra K. Dhameja. He is the professor in HOD Neurology, Lady Hardinge Medical College, Delhi. He is also a WHO fellow with the National Institute of Epidemiology. Thanks so much, Dr. Dhameja, for being with us. The Novavax news has created a lot of excitement. This is a company claim at the moment. This data still needs to be peer-reviewed. But how are you looking at these developments?
I think this is an exciting news, and we have been waiting for more and more vaccines to come in a big basket of vaccines in near future. So this is a dark horse vaccine, US-based vaccine, and this technology is different from the Covishield or Covaxin because this is a protein subunit like the hepatitis B vaccine. So it's a kind of a directly inoculating spike protein encapsulated in a lipid molecule like a soap molecule, and then the body produces immunity against this spike proteins. So it's quite exciting, and the time-tested technology like hepatitis B. The results you are mentioning are actually in the press release. They have to be yet to be published and peer-reviewed. But this is exciting in terms of a large data. So 30,000 people in Mexico and US, mostly in US, 113 sites in US and 6 in Mexico, with over 90% protection against the symptomatic and about 100% protection against the moderate to severe COVID-19 disease. So this actually comes after an initial trial of the same vaccine in UK, which involved 15,000 volunteers in the UK, and that also had around 89% overall efficacy, 83% against the new variant, alpha variant, and the similar kind of against the original one, 96 actually against the original viral strain. So these two trials are very exciting.
Okay, can India actually pin hopes on this vaccine? And if so, what according to you, Dr. Dhameja, is the realistic timeline that we're looking at?
So there are three things to look at. One is that this vaccine is a relatively mild side effects. It is having relatively mild side effects. It means the volunteers which were given this shot had less number of people developing side effects as compared to the other vaccines in terms of numbers. And in terms of people developing infections, there were 77 cases of COVID-19, 63 of them in placebo group. This was a 2-into-1 trial, actually two parts. The 2:1 means 2/3 of the individuals getting the vaccine and 1/3 getting the placebo. So most of them are in the placebo group, 63 of them and 14 of them in the vaccine group. So the results are very exciting in terms of Indian context. So one is relatively mild side effect. Second is the logistics, because it can be refrigerated up to 6 months.
Yes.
And once you open the vial, it can be used for 24 hours.
Do we have any indication of timeline by the end of the year?
Yes, I think the regulators will have a look at the data. I think first they will apply to the US regulators, and then obviously at the same time, the company is likely to apply to the Indian regulators as well. So within a couple of months, I think we should be ready to have this jab in India also.
All right. Well, thanks for joining us on this very important development. It's exciting news of the promise of yet another vaccine being manufactured here by the Serum Institute. So once again, India, of course, pinning its hope on this new vaccine candidate.